letter. So I can see people coming in, Adele, Anisha, Fatima, lots of names coming in. You are all most welcome. It's lovely to see you here. And I am Helen, and I'm joining you from the UK. So please tell me in the chat box, excuse me, what score are you hoping for in OET writing? And if you're joining us on YouTube as well, please interact in the YouTube chat box. What's the score that you are hoping for? Hello, Hongley. Wow, Mahima, we've got a high target there of 400. We've got a 350 and a 370, so quite the range there. And this session is to help you to achieve that target score. And writing as well is really important in your healthcare careers, not just for the OET. But yeah, we are going to get into how to improve your score. So we're going to learn about the OET writing task with a free downloadable PDF, how to prepare, how to analyze a task, how to select relevant information, and we'll also look at the OET criteria on which you are assessed. And if you would like to get more of this kind of content, you can sign up for free at e2testprep.com, and there you can join us for a free trial. You can also have a consultation. If you're not sure about how to begin, book a video consultation with one of our test prep advisors to get you on track for English success. And you can click the link in the chat description or scan to book the consultation. So let's think about the writing method. Well, as you know, you've got 5 minutes for reading. And what you're going to do at this point is read the task, read the case notes, and identify the relevant information, okay? I'm just going to ask you to tell me, what does relevant mean? Okay, it's a really important word, and I would like to know, what does it mean if we say something is relevant? I use this idea asking you what is relevant quite a lot. Okay. Now, in the writing stage, you've got 40 minutes in which you're going to plan 3 to 5 short paragraphs and write the letter. And then most importantly, proofread your writing to make sure that everything is as clear as it can be. I'm just seeing if anyone's got any thoughts on relevant. Got some interesting ideas here. Most important, applicable to the task. Yeah, great ideas there. Okay, now the OET reading task. You're going to see it on the top part of the case notes, and this is what it will look like in the exam on the left here. Okay, so a couple of questions to think about. Question 1, what do we know about our job? And what do we know about our patient? Okay, so please drop that into chat, those 2 questions. What do we know about our job? What do we know about our patient? I'll give you a minute to share that. Yeah, well done, Philip. Yeah, our job is a general practitioner. And what we know about our patient. Okay. Our patient, Mr. John Smith, has chronic lower back pain. Yeah, excellent. So a tip is don't just read the rest of the notes, jump down to the bottom and then read the task itself. So here we have it, the writing task, and it says, using the information in the case notes, write a letter of referral to Miss Carter, a consultant physiotherapist, summarising your assessment and outlining your recommended management plan for Mr. Smith's chronic back pain. Address the letter to Miss Emily Carter, Lifestyle Physio, 255 Commercial Road, Merton. Now, the part at the bottom you see here, that part in bold is always the same, okay? In every exam, every OET exam, you'll see that, okay? And let's take a look at it in more detail so you know what it means. So in black is the copy of what you'll see, and in red is an explanation here. So what does it mean? Well, it means we have to write full sentences. Obviously, not just copy pasting over notes. All right, it's really important to show that you can write full sentences. You need to be able to show that you can write a conventional business letter format, a professional looking letter, and write approximately 180 to 200 words in the body. Okay, so can you tell me, what does approximately mean? Okay, it says write approximately. Yeah, what does that mean if we say approximately? It's a really important word. Yeah, near to. Well done, Tatiana Hongley. It means around, give or take. All right, good job. Okay, so now let's think about some questions that you'll ask yourself when you read the writing task. 4 questions. First one, who am I writing to? Second, what action do I want the reader to take? What does the reader need to know? And what does the reader already know? We don't want to tell them things they already know. We want to update them really on progress of the patient, perhaps. So take a moment now and put into chat your thoughts on those questions. All right, I'll give you a minute to think through those questions. So we've already answered the first one. Who are you writing to? You're writing to Miss Carter, a physiotherapist. And what's the action that you want the reader to take? Well, it's to do physiotherapy with John Smith. What does the reader need to know? What is relevant to the reader? And I come back to this word relevant now because it means important to the reader. Okay. So we want to tell the reader the management plan for John Smith's back pain. And I can also see people in chat have mentioned assessment. Amandeep and Mekdiz have said that. Okay, and Manohar, yes, absolutely. So you'll notice it says summarising your assessment and outlining your recommended management plan. So you'll want to put some notes in, some sentences in about the assessment too. What about the last question? What does the reader already know? And the hint here is that it is a letter of referral. What does the reader already know? Rosa has said, doesn't know the patient, no prior knowledge. Well done, Rosa. Very good. So when you do this exercise and you get this information, it helps you. It helps you to select the relevant information and to organize it logically. In other words, it will help you with your planning to have this nice top-down picture. Okay, it gives you some confidence at the very beginning of OET writing. We're now going to look at the reading time. You've got 5 minutes to read the case notes. And for your copy of these case notes and an example of a high scoring letter, please click the link in the chat. And I think it's also in the description for our friends on YouTube. And you can get a copy of the case notes and the letter that was written from them. Okay. So now let's move on to talk about what goes into the subject lines of the letter. There's a couple of subject lines. Tell me in chat what's going to go in there. Well, we'll have the date, today's date, the 17th of September 2023. And here it says, assume that today's date is this date. And we will have the patient's name and their date of birth. And you can see what's highlighted here is the full name. Now, the full name means the first name and the surname or the family name, and also the title of the patient. So a good question has come into chat. Can you add the age? Do you need to add the age? Let's even just think about that. Okay, I'll just stop sharing for a minute. Do you need to write the age? If you've got the date of birth, do you need to write the age? What do you think? It's giving two kinds of information. No, that's right. No, you don't need to write the age, okay, if you've got the date of birth. If you don't have the date of birth, obviously, then go for the age. Okay, thank you for asking that really important question. Okay, so let's just remember that the OET is testing your ability to read selectively. Selectively means choosing, okay, choosing the right information. And it's important to keep in mind who the reader is and what they need to know in your letter. So now let's look at the case notes. We've got social background, medical history, and current medications. What do you think the reader needs to know? I'll give you a moment to put that in chat. Okay, so here we have the information. So the reader is a physiotherapist and needs to know this, that the patient is an office manager and that they are sitting for most of the day at work. They take little exercise and poor posture. Okay. And they are taking over-the-counter ibuprofen as needed for pain. Now, the other information is actually irrelevant. Remember that we said earlier, relevant means important for the reader. And the reader does not need to know these other pieces of information as a physiotherapist. Okay, so they need to know something about the patient's lifestyle, because this explains how the patient is sedentary, sitting for most of the day at work as an office manager. They take little exercise, they have poor posture. Now, the fact that they're single and they quit smoking 3 years ago, that doesn't really play into their problems with their back pain. Okay, the issues about the medical history are not really relevant for the back pain and the physiotherapist, and neither are the medications for those conditions either. The point about diabetes, someone's asked about that in chat, Rosa, thank you. Well, look, it says the diabetes is well controlled. Okay, the diabetes is well controlled. So that tells the physiotherapist, that tells us something. The physiotherapist doesn't really need to know about well-controlled conditions. Okay, but there's a good hint there. Okay, here we have the history of the present illness. Take a moment to look through that information. Okay. Tell me, what does the reader need to know here? All right, so we have actually everything needs to be explained to the physiotherapist. So the physiotherapist is going to be helping them to overcome their chronic lower back pain, the description of the pain and the position, that it is not radiating anywhere, the level of the pain. And what about this arrow here? An arrow pointing upwards after the word pain and the words with prolonged sitting or standing. What does that arrow mean there? Yeah, well done, Janina. Yeah, it shows an increase, right? So this is the shorthand for increase. But of course, we're not going to write symbols, right? We're going to just understand what that means and put it into words. We also have no history of trauma or recent heavy lifting. We've got the limited relief from over-the-counter pain relievers. And we've got some other information there as well, which would be useful to know. Now, a tip is, as we've said, you've got to change the case notes into full sentences because your language is being assessed. What does language mean? Well, it means grammar, sentence structure, vocabulary, spelling, punctuation. And also it's useful to think about the word order of English SVO, subject, verb, object, okay? Helen taught a class, right? Helen is the subject, taught is the verb, a class is the object. Okay, little challenge for you now. Here are some notes. Try to write these notes as full sentences, and I'll give you a couple of minutes, just a minute. So we've got number 1, experiencing chronic lower back pain for past 12 months. 2, pain and that little symbol with prolonged sitting or standing. 3, tried over-the-counter pain relievers with limited relief. Okay, let's go on. So the first one, we have John Smith has been experiencing chronic back pain for the past 12 months. So we can see the subject and a little bit of present perfect continuous in there. Number 2, let's take a look at that. Oh, well done, Mary. Nice sentence there. Number 2, John Smith, or you could change it to he at this point, feels increased pain with prolonged instances of sitting or standing. Okay, quite a nice simple change there. And number 3, John Smith has tried over-the-counter pain relievers with limited relief. Right? So we've got the present perfect there. Okay, so nothing too complicated is happening, right? Just write some nice, clear, simple sentences. You can either use he, actually, I think this should be Mr. Smith. I would change that to Mr. Smith. Okay. So now let's think about what information the reader needs to know from the investigations and the assessment. What do you think the reader should know from these? Okay, people are saying in chat. Magdiza said the X-ray results. Yes. Yes. Right, so we've got the result of the X-ray of the lumbar spine showing mild degenerative changes in the lumbar vertebrae, and that he has been assessed as having chronic non-specific lower back pain. Okay, now you might not put it exactly like that, but you could rephrase it. Okay, and we said, now what does the reader need to know of the plan? I'll let you look through these. What does the reader need to know of the plan? Abdullah is saying all of it. Exactly, yes, very good. So the referral to the physiotherapist, the time needed, the occupational therapy assessment, the analgesic management, okay, and the need to avoid sitting or standing for a long time, the lifestyle modification advice as well. So a lot to share. Now, if you would like to get an example of the case notes and a high scoring letter, please click the link in chat or description, and you can use that to write your own letter and to get some practice. So now let's look at the scoring and criteria. Now you may know about the way in which OET criteria are covering 5 different aspects of writing, and they are scored at 7. The maximum you can get is 7, and the purpose is scored out of 3. So this is important for you as you consider how to improve your writing score. Now we're going to talk about the 3 highlighted ones in red now. Choosing relevant case notes to include affects these areas: the purpose, the content, and the conciseness and clarity score. Those 3 criteria are connected to the work we've practiced today, choosing the relevant case notes. I'll just mention about that briefly. If you know what you are asking the reader to do, if you're very clear about that, then your purpose is going to be immediately apparent. Okay. Similarly, you're going to include the key information and no important details will be missing. So that's the description of a 7 out of 7. And for conciseness and clarity, that means being short, being clear as well. Okay. If you make sure you exclude irrelevant information, if you don't include irrelevant information, you will score highly on conciseness and clarity. Because as we know, healthcare professionals are busy and they only need to read what they need to read. Okay, so we don't want to take up our readers' time. So that's why thinking about the case notes is so important and it's a skill to work on. So now let's turn to some general strategies and tactics. OET requires you to be flexible, selecting only the information that's relevant and appropriate to the reader and situation, as we've said today. And a template is therefore not recommended for your letter. So each letter you will need to plan afresh, thinking about the needs of the reader. And that's what you will do in the writing time. You'll start with the plan, okay? And if you'd like to learn more about how to change these notes into a letter, do join us at e2language.com and you can sign up. As we've said, the link is in the chat or in the YouTube description, and you can also scan it here. And that's what we are working on. Okay, and there are 4 ways to level up. You can join us and work on practice tasks, watch our E2 Super Method videos again. And yes, this session today is recorded and you can do all those practice activities for this session and other recorded sessions too. You can attempt a mock test. That's a real exam simulation to give you confidence on test day. And we recommend you try mock test 1 when you are 50% through the course. We have small group classes for speaking, and that is with between 1 to 7 students for 50 minutes. It's a lot of fun. And if you're not sure about how to start, please do book a video consultation with one of our test prep advisors to help you get on track for English success. You can click the link in chat in the description or just scan it, and we'll be waiting to help you out and talk through where you're at in your preparation. Okay, so I'll wrap up here. I'd like to say, the OET is a difficult task. It is a difficult test, but it is a doable test. And I know that people have lots of questions about it. And when you join us, we can get into more detail. I'm sorry I haven't answered all the questions I've seen in chat today, but that's what our sessions are there for, to help you and to make sure that you really feel ready when you come to do your test. So thank you very much for joining and see you next time.